Prior to surgery, I will evaluate you and we will look over, I'll kind of hear your story, kind of evaluate what's going on. Obviously do very thorough physical exam on whatever the affected body part is. Almost always you'll end up getting an x-ray of the joint or the body part that hurts. And many times, there's additional imaging like either a CT scan or possibly an MRI that's needed to evaluate the injury. Once we have a really good diagnosis and a really good evaluation of the injury and how exactly it's affecting your life or what problems it's causing you, we'll then come up with a treatment plan in terms of exactly what we're going to do, where that surgery will be done. So depending on the type of patient you are or the type of surgery, I do a lot of my surgeries at ambulatory surgery centers, which are outpatient procedures. You're in and you're out. But then I also do have credentials at a hospital, and so some things require a hospital stay. So we'll kind of go over whatever would be the best, place for your surgery to be done. I try to educate my patients as much as possible through just talking with them. I also have a lot of handouts. I think I have a lot of good information on my website, and we have a lot of videos to help educate patients. On the day of surgery, we try to be in really good communication with the patient on, exactly when to show up. We send in all the medicine beforehand, so patients have everything they need for after the surgery before they even go into the surgery. And usually if home health is required or any types of bracing or icing devices, that will all be set up beforehand. So that way when you come into surgery, you don't have to think about anything. If it's an outpatient surgery, you're going home the same day. And then you'll be, again, depending on the surgery, you may have a home health. If it's one that doesn't require that, we'll set you up typically with outpatient physical therapy. For a lot of my procedures, I do like for patients to go to see their physical therapist the day after surgery. Therapists help us a lot typically after surgery. So again, depending on your type of surgery, you'll probably be seeing your physical therapist 1, 2, or maybe even 3 times a week for a certain amount of time afterwards. And they kind of help guide the post-operative process. I always see patients to take out any stitches or to check a wound afterwards. And then we follow up with you at, certain time periods after the surgery in order to get x-rays to follow the result. Make sure you're improving, the way that you need to be improving and that everything's meeting your expectations.